sweet for days. That's right. Good morning and welcome to another edition of Get Wired Mornings right here on CTV and Talk City 91.1 FM. Well, it's that time where you may want to put your best face forward as you join in the Carnival festivities. And Carnival fun, however, may mean long hours in the sun and you're exposed to pollution and oil. Sunburns can be painful and the impact on the skin can be long-lasting if it is not treated properly. Well, to discuss skincare and health, particularly during the Carnival season, is Cosmetic Dermatologist Dr. Rachael Eckel. Welcome.
Thank you for having me today.
It's a pleasure. We have so much to talk about because this is Carnival season. We're out in the open. We're exposed to so many elements. First of all, let's talk about pollution. What are the different types of pollution and how much is the impact on our skin, especially around this time?
So interestingly, people always blame the sun for their skin looking awful on Ash Wednesday. But we go to the beach and we go down the islands and our skin doesn't necessarily look that bad the next day. One of the biggest culprits at Carnival time that nobody is speaking out about, and this is new science and new research, is pollution. So we get a lot of pollution, for example, from the big trucks that we're next to at Carnival, and those trucks emit air ozone pollution. So they're emitting substances into the environment that we're breathing in that can cause asthma, that can cause COPD to exacerbate, but it also deteriorates our skin. In addition to that air ozone pollution, so the chemicals in the air that land on the skin, another type of pollution is particulate matter. So think about when you're in the savannah and you're crossing the stage and there's all of these dust particles that are in the air from all of these masqueraders, you know, going through the savannah. That is particulate matter. So it's tiny, tiny little dust particles in the air that are sometimes 20 times smaller than a pore. So what the pollution does is that the air ozone pollution and the particulate matter get into the skin. And think of pollution and oil and sun and these guys, think of them as like a gang of like really naughty guys. They're like this gang of misfits, and basically they show up to your skin and they just cause havoc on your skin. And it's almost like the guy who lets everybody enter into the skin is pollution. Pollution is the first insult to the skin. What pollution does is it basically blows holes in the skin, and your skin is meant to act as a shield or a barrier. So sun is not meant to get in, pollution is not meant to get in, but what the pollution does is it disrupts the barrier function of the skin and it allows everything else to penetrate like the sun and cause inflammation and much more damage to the skin. So pollution is the first thing that basically opens the gates so that everybody can get in and cause inflammation and havoc on the skin. And what inflammation does from research studies is it causes large pores, it causes rough texture, acne breakouts, rosacea breakouts, sensitivity, redness, hyperpigmentation. But interestingly, it doesn't cause hyperpigmentation on your hands in a landmark study that was done on China. It only causes it on the face, and that's because we produce oil on our face, which I'll come to in a minute. So pollution, everything that you see on Ash Wednesday that you don't like about your skin, pollution is a major culprit behind that.
Now, interestingly, you mentioned that the particulate, the matter itself, is actually smaller than the pores on your skin. So
20 times smaller than a pore. So what it does is it literally enters into the pore and it mixes with oil, right? So oil that we make. And oil and pollution are best friends, but they are the nastiest things when it comes to the skin, because when these two guys combine, you create this really irritating, nasty, noxious substance that just eats away at the skin and causes inflammation, causes hyperpigmentation, causes more acne, causes rosacea, sensitivity. So those two together, when you have them in combination, is an absolute disaster. Not only do we have a lot of pollution coming out from the trucks and whatnot, but in addition to that, because we have such a hot climate, the heat and the humidity activate these chemicals even more and make them even more detrimental to skin. And interestingly, 2 days ago, I had a patient coming to my practice and tell me that after Carnival, it takes about 6 months for her skin to recover just after Carnival. But there are many things that we can do to protect against pollution.
Well, that we need to speak about. So how do we even begin this fight against pollution and sun exposure and oil all at the same time?
Sure. So you can't stop the pollution from happening, right? But we can do things to negate the ill effects. First of all, when you come home from Carnival and you've had a couple drinks, you can't just go in your bed and fall asleep. You've got to take off the pollution, the makeup, the oil from your skin. If you allow that to stay on overnight and settle on your skin, you're going to see these ill effects. So the most important thing is cleansing the face. And what you want to do is you want to use a cleanser specifically. I like cleansers that contain little micro beads in it. So like tiny little golf balls that you rub on the skin that help to lift the particles, the pollution particles off the skin. Interestingly, if you just wash with soap and water for 5-7 seconds, it doesn't get pollution off the skin. You have to work hard to get it off the skin. It takes about 60 seconds of cleansing the face to remove pollution and oil and sebum from the skin. So cleansing, and actually after Carnival, I would recommend a double cleanse. So cleanse once, especially in females, for a minute to take off your makeup, and then do a second cleanse to get rid of skin soils and pollution and prepare you for your creams.
But with cleansing, we would need specific kinds of products. Can we use anything?
So I think it's important to remember that 80% of the population has oily skin. So once you can see a large pore, you have oily skin. The most common conditions I treat in clinical practice are diseases of oil, like acne, like rosacea, blackheads, these sort of things. So 80% of the population has oily skin, so that's most of us. And so a cleanser that contains salicylic acid. Salicylic acid is an oil buster. So a cleanser that contains salicylic acid to degrease the skin and get rid of the oil is perfect. So look for that ingredient, but also look for little exfoliants in it, like microbeads, to help to lift the pollution particles a little bit better in some of the old cells.
Now, I've heard that sunburn or sun exposure is perhaps the #1 cause of premature aging.
Yeah.
So what products do you recommend for sun exposure, especially SPF 30, 50, and what types of products are we looking at? And then it could be quite greasy, especially being on the road. And you're exposed to so much heat and sweat.
So a couple things to know about sunscreen is that it's not just Caucasian skin that needs sunscreen, because in the sun, I'm going to react differently to you. So the sun equally destroys our skin, but in me, I may burn, freckle, get skin cancer, get freckles, those sort of things. But in you, you don't get any of that. In your skin after Carnival,
it peels.
you will get maybe larger pores, more oily, more acne, more breakouts, more hyperpigmentation. So how sun affects different ethnicities just looks different. But we're all affected negatively, irrespective of the color of our skin. And the darker you are, you won't burn. But the lighter you are, we will. But you'll still be affected. So the most important thing we can do is protect against the sun by using sunscreen. Any sunscreen above SPF of 30 is what you need. An SPF of 30 has a 95% protection against UV radiation. An SPF of 50 has a 97% protection. So SPF 100, do the math. You don't really need something that high. So anything above 30. The most important thing about sunscreen is not the SPF value, it's reapplication. Because after an hour or 2 hours and you're sweating and you're on the road, it's gone. You have nothing there.
Which brings me to my next question. The liquid SPF that we have, it's thick, and to put that on over your makeup, what products would you recommend?
So I would recommend a cream sunscreen prior to putting on your makeup. And specifically, you mentioned nothing greasy. So you want a matte finish, and this is gorgeous on the skin. And I'll actually put a little bit on the back of your hand for you to see. So this is my #1 sunscreen that I use in darker ethnicities. And what you'll notice in this is that it basically goes on clear, so it doesn't look white on your skin type, and it has a matte finish and an oil control ingredient in it so that you don't get oily when you have it on. So it looks really elegant. And so I would put this on prior to makeup. But people don't reapply sunscreen at Carnival because they don't like how that looks on top of makeup and all these layers.
It'll mess things up.
Exactly. So what I do with them then is that this is my favorite product for Carnival. This is what we call a brush-on sunscreen.
I've never heard of a brush-on sunscreen.
I know. Fabulous, right? So this was the #1 question that people ask about Carnival. How do I reapply my sunscreen successfully? So basically, Color Science is a medical brand of makeup, of mineral makeup. And what this is an SPF of 50, okay? Wow. And what you see in there, that's not makeup. That's an SPF. That's just zinc and titanium. So this is suitable for even the most sensitive of skin types. People who have eczema, people who have psoriasis, sensitive skin, you can use this on all skin types, and it doesn't cause irritation or sensitivity. Basically what you do is you get the sunscreen there, you see it, and you get it onto the brush, and then you just go in circles and you reapply. So I have on some makeup this morning, and you can see when I reapply my sunscreen, You don't see anything. And it just goes on seamless. And that gives you an SPF of 50. So what's nice is that the powder mattifies that oily, greasy, shiny look in the selfies. And then the SPF protects you against the UV radiation, and it's an SPF of 50. So I carry that in my little bag while I'm on the road. And every couple hours, remember, sunscreen comes off with sweat. You sweat it off. It comes off with humidity. So you need to reapply. That's the most important thing you can do.
And you have different shades of these, I understand.
Yeah, so there's different shades, so you can get it to color match any color, any ethnicity.
All right, so I'd like to talk a little bit about those who already have sun damage. They may think it's too late. My skin is already wrinkled. Are there any treatments you would recommend?
So sun damage can take on many different forms depending on the ethnicity of the patient, on the age. I think it's always best to start early. So if you see early sun damage, start then. Don't wait until you're 50 or 60 to treat the sun damage, because then you got to throw the kitchen sink at it. So it's better to prevent and to treat from an early stage, because the longer disease is present is the deeper down into the skin it goes and the deeper the roots are, and then you might need lasers and stuff like that to treat it. So start early. Second thing, remember that early sun damage is not cute. So when I was younger, for example, I'm Caucasian living in this beautiful hot warm climate, and I loved the sun growing up, and I never wore sunscreen, and I had really bad freckles and sun damage. I even had a skin cancer across the bridge of my nose at 27, and my nickname was Rachael Eckel. So just covered in freckles and always wearing makeup to cover it up. And so I started treating my skin at the age of 27 with prescription topicals. So things like vitamin A, antioxidants, DNA repair enzymes. And now I go without wearing makeup on a daily basis. So it's very easy to treat. You can use topicals to treat sun damage. But again, the number one thing is stop the sun damage from occurring by wearing sunscreen on a daily basis.
Right. With skin health, you tend to talk a lot about hydration. I remember just before the program started, you told me that hydration is definitely important, and you also spoke about people having some stuff in their bags to take with them. So what sort of things should we have in our bags when we're on the road?
What a great question. So in my emergency kit on the road, so I'm lucky that I have the most amazing boyfriend who always carries my little goodie bag on his back with my extra pair of shoes and whatnot. So I'm very grateful for Blake for that. But what's in my bag is, first of all, a comfortable pair of shoes, because I start off with my high heels and then an hour later I'm in the regular pair of shoes. So something comfortable for when you get blisters. Second thing is sunscreen. Not just for your face, but you need a sunscreen for your body as well. So a spray sunscreen I like because it's not greasy, it's easy to apply, it's quick on the road, okay? So I have sunscreen. I also have plasters, because everybody gets blisters at Carnival, and that can absolutely ruin your Carnival. So I have plasters, but if you just put a plaster on top of your blister, it's still gonna hurt. So I also pack a little bit of cotton wool, and so if the blister occurs, put a little bit of cotton wool and then the plaster on top, and it'll provide a little bit of cushioning so you don't feel the pain. Third thing is that people tend to get hot on the road, and they tend to get headaches, and they feel sometimes a little bit sick on the road. So I always have paracetamol or Tylenol in my bag. It's safe and effective to have even if you're having a couple drinks on the road. So that's always there just in case I end up with a headache or some sunstroke.
Great. Now, what should the daily skincare routine be? Even, just forget about Carnival. In general, for any woman, what should that routine be like?
So I call that the fundamental 5. So the 5 fundamental steps that are required to gain skin health and maintain skin health. So cleansing twice a day with, if you have oily skin, an oil dissolving cleanser. Scrubbing once a day with a very gentle scrub that just helps to lift dead cells, get rid of pollution, give you that lovely glow like you've just had a microdermabrasion when you come out your shower. And the third is oil control pads, okay? And what they do is, that's great at Carnival, because when you put these, it's like a toner, but it's an oil control toner. Okay. And basically when you wipe the face with them, it sucks the oil out the skin, but it also leaves a layer layer of substance that any oil that comes to the surface throughout the day, or with Carnival, it neutralizes. So that's wash, scrub, tone. The one most important cream, which is amazing post Carnival and is awesome for pollution, is something that I use called Daily Power Defense, but basically something that contains things to strengthen the barrier function. Things like ceramides, DNA repair enzymes, antioxidants. And the last thing is a sunscreen every day. So your fundamental 5.
Oh, great, awesome. Well, closing comments, what would you have to say to those looking on, thinking about hitting the roads this Carnival, or even the beach perhaps?
Yeah. Well, I think, remember that you are beautiful, and it's all about confidence at Carnival. So let your confidence shine, let your beauty shine. I hope everybody has a gorgeous Carnival. And if you have any extra questions, you can always message me on social media at Dr. Rachael Eckel on Instagram and Facebook. And if your skin is not looking that great on Ash Wednesday, I can help you.
And where are you located?
We are located at 8 Anderson Terrace in Maraval, and the name of our clinic is the Skin Health Institute.
Great, definitely. Thank you so much. I'll be paying you a visit.
Thanks for having me.
My pleasure. Well, you are viewing Get Wired Mornings.